not lowering our guard. Prime Minister stressed on it in the high-level meeting that he had with authorities. He said, even if you are fully vaccinated, please do not forget COVID-appropriate behavior. And Dr. Seth, I want to talk to you about the severity of this new variant, and there's so much talk about the transmissibility of it.
Yeah, I think we've got to understand a few aspects, that we are talking about a variant which is of concern, but we should not panic around it. It just reminds us about precautions. It reminds us about the problems which lurk around at every step. The fact that we've got a variant is not a surprise. We've been expecting variants, and variants have been happening with every virus. I want to dwell, I'm not a virologist, but I can actually guide you, because I've been directly involved in treating patients for the last 2 years. That fine, it's got numerous mutations, and that's why the concern. The theoretical concern at the moment, and in some ways practical also, is the fact that it perhaps is more infective. But we're still not certain that whether can it cause extremely severe illnesses, or would it just cause mild illnesses? That's one aspect. And second, we're still not certain, though theoretically it may sound like that can it bypass immunity, whether innate or vaccine administered immunity. Those are the aspects that we will know over the next 3 to 4 weeks. But this is correct, that we just can't be complacent. It reminds us about every precautions we got to take. And I must compliment the government being proactive in this sort of a situation, where suddenly the border checks have started, the traveler checks have started, genomic testing and scrutiny and surveillance has gone paramount. And our Prime Minister actually taking a stock of the situation well beforehand, even before we actually know that this is even going to be coming anywhere, is a true example of how we at this stage are going to be better protected than we were when Delta variant took us unawares, because I think our systems were not so much in place. I want to emphasize that. And we are now better in place for all, as you know, that clearly the genomic testing groups have got together for this surveillance. It's no more individualized. Numerous laboratories and numerous experts are together on top of genomic testing and sequencing for multiple samples, which were not something which was done in the past. So I think let us remember one aspect that this has reminded us. It has reminded us that variants will come, but COVID is not gone. We've still got our biggest vaccination and protection with us, which is masking, and which is double masking. And let's not do away with masking, because double vaccination and double masking in the community as we go out there has to become a norm, just like our clothes.